Hi, Miss Hines. I'm Dr. Scholl. How are you doing today?
I'm a bit nervous and just curious as to what's going on with me.
Okay, well, don't be too worried. Even if the results aren't what we are expecting, we will always try to make your life as normal as possible. So why don't you tell me about yourself?
I'm 40. I have 5 beautiful children. I am an elementary school teacher, and lately I've just become a bit sluggish. It's been pretty difficult to keep up with them and my own children at home as well. I was experiencing some extreme headaches and nausea, so I took some mini home pregnancy tests and they all came back negative, so I rolled that one out. My arms and legs have just felt like there's weights attached to them. My muscles are just so weak, and I came to see you, but my parents are in their 70s, they're doing perfectly fine, they have great health, so I didn't think there's anything that I could inherit from them.
Okay, well, we sent off your DNA and I have the results here with us.
What were the results? Were they good?
Okay, well, I'm going to start by telling you that you're not crazy and that your muscle weakness and your droopy eyelid, they do mean something. So,
is that a good thing or a bad thing?
Well, in this case, unfortunately, it isn't a good thing. Your nausea and headaches, they don't particularly have to do with the diagnosis that we've determined, but it could be a result of the diagnosis I'm about to give you.
Okay.
To start off, based off of your symptoms and the results of your test, we have determined that you have Kearns-Sayre syndrome, which also stands for KSS.
Kearns-Sayre syndrome? I've never heard of it. What does it mean?
I'll get to the syndrome in just a moment, but for now I need you to know that it's a very rare disorder. About 1 to 3 in every 100,000 people have it, which is why you've probably never heard of it before.
Oh my god, it's rare. How rare? What about my kids? Like, I can't die. What about my kids?
Sometimes take a deep breath. We can get this all figured out. Your doctor to patient. I just need you to calm down and we can get this all figured out.
Okay, I'm ready.
Okay, I'm going to give you a piece of paper and a pen so that you can take some notes down yourself. I'll give you some papers at the end so that you can take home, but you might want to have your own notes with you.
Okay.
So once again, you have Kearns-Sayre syndrome, which is spelled K-E-A-R-N-S with a space, and then S-A-Y-R-E syndrome. This is a rare neuromuscular disorder that causes abnormalities in the DNA of your mitochondria. Your mitochondria are small, rod-like structures that are found in all cells that create energy for functions. And this can also cause issues with your organs and your tissues. So does that all make sense so far?
Yes, it does. Keep going, please.
Okay, this disorder mainly affects your heart, your eyes, balance, and the proteins that affect your brain and your spinal cord.
So that's essentially, that's basically everything. So does that mean that my body's just gonna start shutting down, or it's?
No, it doesn't. I understand it sounds like a lot of things that are wrong, but it will all work out. So based off your physical exam here in the office, I noticed a slight droopiness in your left eye, which is a pretty big characteristic of KSS. To go further with your eyes, KSS causes people to have what is known as progressive external ophthalmoplegia, which is a weakening of your eye muscles, and it causes limited eye movement and droopy eyelids. So I'm going to show you this picture here. This is a patient who has KSS. This is the typical eye test that you do with the eye doctor, where you have to look straight and left, right, up and down. So as you can see, there's not really a whole lot of variation with her eye movements when she does each of these, which this is kind of a severe case of KSS.
So does that mean my eyes could end up looking like that?
They could, but you know, this is an extreme case, so it might not happen to you at all. You might just have slight droopiness. So to add, people with Kearns-Sayre syndrome usually have at least one of the following signs. So there's cardiac conduction defects, which is where there's abnormalities in the electrical signals to the heart, or that control your heartbeat. There's ataxia, which is issues of coordination and balance. There's also cerebral spinal fluid, which is CSF, which is when there's high levels of protein in the fluid that surrounds and protects your brain and your spinal cord. The side effects I mentioned are the most common in KSS, but there can also be muscle weakness, like you've had, where it feels like you're carrying weights at all times. There could be deafness, dementia, and typically people with KSS have a shorter stature. So.
That's a lot of things wrong with me. So, what about my kids? What is the probability of my kids inheriting this from me?
Well, I understand you have 5 children, correct?
Yes, I do.
Do you mind me asking how many boys and how many girls you have?
I have 3 boys and 2 girls.
Okay. Kearns-Sayre syndrome can be passed down through genetics, but it can only be passed through females. So what this means is that all 5 of your children could potentially inherit KSS, but only your 2 daughters would pass it on to their children. Your boys wouldn't pass it on to their children.
I can't believe this is happening to me.
It's okay. Keep in mind this is a rare disorder and it only appears in around every 1 in 24 births. So there's a pretty slim chance that your children will have it, but that doesn't mean that their children's children wouldn't have it. So it's very, there's a lot of chances that it could and couldn't happen.
I understand.
There are medications and surgeries available to help improve your lifestyle in the future.
Okay, what are the treatments? Is there a cure? Is it going to be like chemotherapy where it's just going to dry me down and weaken my body?
There isn't a cure for KSS. In the future, obviously we're hoping that there could be treatment options to try and inhibit the mutations in the mitochondria replication, which is what causes KSS. But for now, in order to keep up with your heart, I recommend you get frequent checkups with electrocardiograms, which is also known as ECGs. This helps detect heart block, which is actually a really common cause of death for patients with KSS. It's about 20% of the patients. I also recommend an early pacemaker implantation, which can help with the electrical signals issues with your heartbeat. And then, just like every other doctor says, exercise can obviously help, particularly with your muscle strength, so that you don't feel so weak all the time. There's also a medication called ubiquinone, which can help with headaches and overall heart health.
Okay, so if I will take this medication and take your recommendation is to exercising everything, could this possibly prolong my life?
Of course, we are trying to prolong your life through these recommendations, but of course, with everything, there is no guarantee. I expect to continue seeing you in follow-up appointments, and I just really need you to try and stay positive, and don't worry, we will figure out a way to make this the best situation possible. I'll hope to see you in a couple weeks to check on your condition.
Thank you so much, Dr. Stoll.
You're welcome.
So much.
I'll see you later.